Hey guys, this is Dr. Shaw here, Austin Urology Institute.
Hi, I'm Alex. I'm the lead nurse practitioner with Austin Urology Institute.
Yeah, and we're just doing a couple of informal videos here just to shoot the breeze about different things we deal with in urology on a day-to-day basis. And for this video, I want to talk about the dangers, I don't want to be too dramatic, of BPH meds. And I do remember someone once told me if a medicine has no side effects, it probably doesn't have any effects.
Right.
So if you think about it, any medicine, any drug that we put in our body, there's an action and a reaction. And I tell people, even aspirin that most of us have taken at some point in our life, on the little subject or the little back of the bottle warning label, it says you could bleed to death.
Yeah.
So even aspirin, has trouble. I'll also say I don't understand how I got here, but I've been doing this for like over 20 years now. And I will have to say, when I came out of medical school, went to all the pharmaceutical, educational things, is that I was a pill pusher. I'm now a reformed pill pusher because, that's how we were taught in medical school. You here's a problem and here's a pill to solve the problem, and you got taken out for lunch or dinner for it, right?
Yep.
And as I've progressed in my career, I've kind of realized, hey, what if you can get away from the medications? What if you don't have to take a pill? And what if there's an easy solution? Sometimes it's diet, exercise, whatever. But sometimes, we've also seen advances in surgical therapy to where, you can go through a simple procedure and rid yourself of a lifetime of medication. And when it comes to the prostate, we'll talk about that a little bit more here. Here's the bladder, here's the prostate. It can become cancerous as you age. It can enlarge as you age, and thus, you hear about the old men with pushing, straining, difficulty urinating. And then there's a whole host of medications, right, to treat it. So Alex, what are some of those medicines?
So the most popular ones you're going to hear about are alpha blockers. So that's your Tamsulosin, your Alfuzosin. The most common name is Flomax. You hear about that one. I would say out of the two classes of medications that we utilize, they are the most benign out of them. But we do try to get patients off of these, mainly to decrease polypharmacy. I like to tell my patients, as we get older, you're going to have to start taking other medications for other things, diabetes, blood pressure issues, statins. So the less amount of medicines we can add to that list, the better for the patient. So Flomax and Alfuzosin, these are alpha blockers. So what they do is they relax the smooth muscle of the prostate. So they basically open up this prostatic channel here so that you can empty your bladder better. So the side effects of those medications are orthostatic hypotension. So they can drop your blood pressure by about 5 to 6 points. So as we get older, our blood pressure becomes a little bit more labile. So the last thing we want are for our older patients or even younger patients to, whenever they get up to stand up, they have a kind of like a head rush. That's your body trying to compensate your blood pressure. So if you decrease that compensation, you can actually have syncopal episodes and you can pass out from that. And I've had patients actually have that happen. One other thing it can do is it can cause retrograde ejaculation. So the stuff that we produce out, right, it actually goes into the bladder. So a lot of my younger patients really, really do not like that. That's one of the side effects that they have from the alpha blockers. What else?
Fatigue.
Fatigue.
Fatigue from the decreased blood pressure. We talked about blood pressure. We talked about less stuff.
Yep.
Ejaculate volume. And the other example, you and I talked the same, is the way I look at it is, say if you can't breathe well, you take a little nasal spray like an Afrin or whatever, and it opens up your nose so you can breathe better. So these medicines are basically like that. So, so just as it opens up your nose, this opens up your prostate so I can pee better. But you are right, it's temporary. If you forget a pill, you forgot to take it with you on vacation, or whatever it is, just like your nose, the next day you can't breathe again. So the same way, and I've really kind of looked at it, this medicine, a different way. It's a Band-Aid.
Right.
It's not treating anything. It's just managing your symptoms.
Right. And they have side effects along with it.
Yeah.
The other medicines out there are 5-alpha reductase. So these are medicines called like Finasteride, Dutasteride.
The blue pill.
The blue pill.
Yeah. And those are nasty, nasty, nasty.
They are.
Yeah.
And so what they actually do is actually shrink the prostatic gland. And now they've released some black box warnings on these medications that they can have earlier cognitive decline. the way that they work is they knock down your DHT receptors, so fatigue, low libido, erectile dysfunction has been reported with these medicines. So the last thing you want are these patients to be on dual therapy where they have, some cognitive decline and low blood pressure, and they're getting up in the middle of the night because of nocturia. You're going to get up, pass out, and you may not know where you're at, and you can have a really big adverse event.
So real quick, I was going to say, these DHT receptors are in two major parts of your body. One is on your noggin. So finasteride is remarketed as Propecia, right? So somebody may be on that. And in fact, I probably should take it for my thinning hair, but I'm afraid to because of the side effects. Because, so that DHT is on your head and it's on your prostate. So if you block it, you may have more hair, but you will get a smaller prostate over a period of 6 months to a year. But the prices that you're going to pay are...
So the low fatigue, the erectile dysfunction, and then potentially cognitive decline. And it can also mask prostate cancer. That's one thing. So if you shrink the prostate gland, the medicine does not care about prostate cancer. And the one way that we monitor for prostate cancer is your PSA. So if you're taking this medication and your PSA, if it's above 4, it should be investigated more thoroughly. Sometimes that can knock it down to an artificial 2. And if you're not careful, it can mask the prostate cancer.
Yeah. So, so point is, and I don't want to knock it too much in that I used to prescribe these medications like in the first half of my career. The second half of my career, I am doing my darndest to get people off these things, the black box warning says, this, in some cases, this is not reversible, depression and other things like that. So, what guy wants less testosterone as you age? I don't see anyone raising their hand. So the point is, this stuff is bad. I don't think it's well known that, the side effects of these things. And, Alex and I see a lot of patients who are on often a combination, one alpha blocker and one finasteride pill. So if you do the math, you're taking 2 extra pills for your prostate, multiplied over by a period of a year, you're taking over 700 extra tablets a day into your body with those side effects.
Well, and they don't do the same as a simple office procedure or even an OR procedure. I think the literature shows that it decreases the IPSS score by an average 8 to 10 points. And if you do something like one of our office-based procedures or our OR-based procedures, we're seeing IPSS scores drop. So that's the International Prostate Symptom Score, a score from 0 to 35. We're seeing those drop from 30s all the way down to even lower mild symptoms like below 5s. You're not seeing that on dual therapy. And what it doesn't do, so these medicines don't do much for bladder outlet obstruction. So unfortunately, I've had patients that have come over to the office that have been on dual therapy for years and years and years, and I do a simple office-based procedure like a cystoscope, and I go in there and their bladder has been so severely trabeculated, which shows damage to the bladder because they're not getting the relief of some office-based or OR-based procedures. So the whole point is deprescribing, decreasing polypharmacy, but these office-based procedures often offer a lot more relief than these medications do.
Yeah, and my take home for everyone out there is that these are Band-Aids. They don't fix the problem. And one thing that has happened over, my 20 years of practice is there are, before, and this is the subject of the next video, is you could get a TERP or rotary router, but you could kiss your ejaculate goodbye. You could have erectile dysfunction. You paid a price for it. The beauty is in 2025 now is we have therapies where you can basically somewhat have your cake and eat it too. Is where you can have these therapies with minimal side effects in that regard.
That's right.
Cool.